have a personal electronic health record. I know some people have it through their insurance carrier, and it's based on claims data from your physicians. But the American Health Information Management Association estimates that more than 80% of doctors now and 70% of hospitals are using electronic health records. It makes the exchange of medical information safer, more accurate, and more efficient. I'm going to use my dog as an example. I have an app on my phone. I scheduled the appointment. I went in for a visit. When I got home, they had emailed me the history and physical. I got a text with the lab results, and then the next day I got an alert that he was due for one of his for his heartworm medicine. So I mean, his care is actually more coordinated than mine. So what AHIMA suggests is, and this is actually a national patient identifier. When information is exchanged between different facilities or different physicians, there's a 50 to 60% chance of it being inaccurate. So you can have a duplicate record, the wrong patient, and this results in misdiagnoses, inappropriate treatments, unnecessary tests. So it's actually creates a higher risk for the patient and a higher cost for the patient. So what they suggest is a voluntary system. So patients could choose to participate or not. It wouldn't be mandatory. Patients would select their own identifier. So it'd be like creating an account for Google, whatever. You would create your own user ID and password, and you would give your provider permission to exchange that information. Right now I have one ID for my insurance, one ID for my pharmacy. When I go to the doctor, they use my social security number. So there's a lot of inaccuracies because of that. I know for some of the older generations, it seems kind of Orwellian that let's say the federal government would have, a national identifier, but we actually already have one called the Social Security number. And so I think what you're probably thinking next is, what about privacy? But actually the privacy laws created around this would actually be much more stringent than because actually medical identity theft is on the rise. So I mean, there would have to be privacy laws in place. Currently, when it was proposed, the Department of Health and Human Services is prohibited by law from using federal funds to find a solution for this. So ideally, the unique identifier would quickly and accurately identify patients. So when you went to the hospital, it wouldn't be like you wouldn't be registering, filling out, 10 pages of paperwork, and doctors and hospitals could exchange information. What you can do is sign a petition at www.ahima.org. They also have graphics that you can post on your Facebook page, and they have templates that you can use to email friends or family, and also a template that you can send to the media.